Palm Beach, Dade, and Broward counties for the last 25 years. The practice of medicine is changing dramatically. All County Healthcare, Inc. still does it the old-fashioned way, where our nurses and healthcare professionals come into your home to service your medical needs, providing you the fastest and best care possible. For more information, call 954-717-7027. And remember, Medicare Home Care is covered by Part A of Medicare with no out-of-pocket cost to you. It's your decision, and only your decision, on what healthcare agency you use. Call today. All County Home Health Care, Inc. at 954-717-7027. License 200999096. The opinions expressed on the following sponsored program are strictly those of the host, guests, and callers, and not necessarily those of this station, its staff, management, or sponsors. Amp2.tv presents You and Your Doctor, teaching you to live a longer and healthier life. Proudly sponsored by All County Healthcare, where people are the heart of our business. All County Healthcare is a Medicare certified agency where one call will service all your home care health needs. For more information, call 954-717-7027 or visit our website, allcountyhealthcare.com. Now, let's get informed to living a longer and healthier life. Here is your host for today's show.
Hello, South Florida and beyond, and welcome to the You and Your Doctor show, living a longer and healthier life. I'm really excited this evening because we're going to be talking about a very specialized form of neurosurgery. We're here with Dr. Raghuram Sampath. Dr. Raghu Sampath, he's a cerebrovascular and skull-based neurosurgeon with the Palm Beach Neuroscience Institute here in Palm Beach County, as well as the Advanced Neuroscience Network Physicians Group in Miami-Dade County, Hialeah area. And right here in Boca Raton, I'm happy to report as well, he's the affiliate clinical assistant professor at the Charles E. Schmidt School of Medicine at Florida Atlantic University. If you know this program, that's my alumni. So I'm an alumni there, so I'm really happy to hear that as well. But without further ado, Dr. Raghu Sampath, how are you doing this evening?
Very good. Thank you. Thank you for having me here.
Thank you for joining us. I always take this adventure of health because we always learn so much from our guests. So I'm going to get right into it. You're a medical specialty. I'm going to let you describe it. So can you describe cerebrovascular and skull-based neurosurgery, your specialty?
So yes, well, you do a training in neurosurgery. So all neurosurgeons have finished their residency training. You can then subspecialize or choose what else you want to train in. And there's different subspecialties like spine surgery, pediatrics, neurosurgery. I specialized in something called skull-based surgery, and because I have such good training during my residency related to vessels of the brain as well, that's why I went on to also do another year of specialization in vascular neurosurgery. So you're basically dealing with structures, basically nerves and arteries at the base of the brain, so skull base. And since you're dealing with both, you also train how to handle blood vessels in the brain, and that's cerebrovascular surgery.
That's a great description. I always ask this second question because we have a lot of baby boomers, like my parents in their 60s and 70s, that population here in South Florida, and senior citizens as well as the elderly population. So do you just treat adults, or is this something that kind of crosses over between pediatric and adults?
I mostly treat adults. There are certain conditions in my subspecialty of cerebrovascular and skull base that can afflict unfortunate children as well. So only in those situations do I also partner with a colleague of mine who's a pediatric neurosurgeon, and we then address if it needs my surgical expertise. I do it with them. I by myself do not treat kids. Adults, yes. And as regards your question about baby boomers or adults in their 60s and 70s, those tend to make, I think, about 50% of the patients I see. Most tend to be 30s. For the rest, 50% tend to be 30s, 40s, maybe early 50s.
Okay, so yeah, half of your patient base is
in the 60s, yes, some 70s. And I have seen some patients even in their late 70s, early 80s. But, as you start looking at the age, you have to also go by what is best for them, not what is best for them overall, and not just what is the best way to treat this. What you have to start thinking, what is the best way to treat the patient, and age comes into that consideration a lot.
Another question I'd have is, so are you a trauma-based neurosurgeon, or are you more of someone who would be, called in and the procedure would be planned out?
Not trauma, but emergency, yes.
Emergency.
Trauma, of course, falls, accidents, things like that. But I am available for my colleagues for being called anytime for expertise only in the area that I deal with. And again, about 60% of the time, it can be an acute or what we call semi-urgent or urgent. It's not middle of the night right there, deal with the issue kind of emergency. It's something that can be handled over the next few hours. So in that way, yes, emergency or urgency, yes, but not trauma. And the rest, about 30-40%, tend to be more on a decided or planned basis.
And you have a very long list of areas of interest that you specialize in, and I'm going to give out the information where everyone can see that in a minute. But I wanted to ask you, what is some of the, I know it's not common, you deal with so many things, but what are some of the main reasons a patient either enters your office or you get called into a hospital to do a procedure? Is there a specific ailment that seems to come up more than others in what you do?
Yes, again, even in that, there is two ways how this can all present itself. Either the emergency, like I mentioned, basically everything starts off with getting at least a CT scan and then proceed from there, going on to other tests to diagnose something that I deal with, such as blood vessels or sometimes tumors. The other ones are usually found, sometimes patients can have very vague or what we call benign symptoms. And basically the starting point from there is to get an MRI or a CT. And once you see anything that deals with anything that's in the base of the skull or the bottom of the brain, around the base or floor of the brain or the skull bone, then I get involved. So that's how I get called. So someone could have something as simple as some dizziness, or someone could say, yes, my ear rings, and then you go on to get all the tests, and then you find something that needs more expertise. So that's one way of how I see patients as an example. And the other side I mentioned is something that comes as an emergency, and different tests, either with CAT scans or MRIs or other more specific tests. And then the other colleagues I have will alert me and bring me into the foray there to look at blood vessels or bleeding, things like that.
And we're here with Dr. Sampath. He's a cerebrovascular and skull-based neurosurgeon here in Palm Beach County with the Palm Beach Neuroscience Institute. You can see all of his areas of interest at pbni.com. And then also in Miami-Dade County with Advanced Neuroscience Network Physicians Group. That's ANNPphysicians.com. Dr. Sampath is on staff at St. Mary's Medical Center in Palm Beach County and Palmetto General Hospital in Miami-Dade County in the area of Hialeah. Two great hospitals as well. So I will give out Dr. Sampath's number, 305-823-8510, and later on give you the addresses of those offices. I read a testimonial here in Palm Beach County for an arteriovenous malformation, and then the testimony on the care you provided. So there was a lot going on there with there. I feel like maybe some people are born with that, that may be a congenital ailment that is developed. But tell us a little bit about arteriovenous malformation, because when I looked it up, I was surprised at how much information, how common that ailment is.
It is not that common, but yes, if I deal with that, then for me it becomes a little bit more common. So it's one of those things. As the name suggests, I'll break it down. Arterio, so dealing with arteries; venous, dealing with veins; malformation, as in not formed well or malformed. So it's an abnormal connection between the arteries and veins in the brain. It can happen in your kidney, it can happen in your spine, it can happen to any organ in the body. So the connection and the flow of blood from the artery to the vein is abnormal, and you generally either find it sometimes what we call incidental, as in you stumble upon it. Again, patient says, I have some headache, and you get a scan and you find it. Or in really unfortunate and bad circumstances, they burst or they rupture and there's bleeding, and then you go on to diagnose it. Some patients can also have seizures, like this patient we talked about on my testimonial in West Palm Beach. And there are many tests, starting with a CAT scan, going on to MRI, and then more specialized tests, something called an angiogram, where you look at arteries and how the blood is flowing into the veins and take X-ray pictures. So all these are standard tests to diagnose these. And of course, it depends on how young the patient is again, or how old, what's their general health, what's this arteriovenous malformation or AVM, what is it doing to them, does it need treatment, how big is it, if you need to treat it, how are you going to treat it? So many things come into discussion.
And if you want to see that testimonial, again, it's pbni.com. Just click on Dr. Sampath there, or put Sampath in the search bar. It's Sampath, and you can see that testimonial. Hard to believe we're already halfway through, but on the other side, we're going to take a quick commercial break, talk a little bit about cavernous malformations, cerebrovascular bypass surgery, and other cerebrovascular and skull-based neurosurgical ailments on the You and Your Doctor show.
All County Healthcare has exciting news for any and all patients with COPD or other respiratory ailments. Listen to what renowned pulmonologist Dr. Keith Robinson has to say.
Hello, I'm Dr. Keith Robinson, board-certified pulmonologist, medical director at Fusion Health Pulmonary Rehabilitation, and a board member with the American Lung Association of South Florida. We have exciting news for patients with COPD. We now offer IPV therapy at home, which has been demonstrated to improve airway clearance, decrease hospitalization, and improve quality of life of patients with COPD. Please call All County Healthcare for more information about this FDA-approved therapy.
For further information, call All County Healthcare now at 954-717-7027. That is 954-717-7027, or visit our website at allcountyhealthcare.com. You can also find us on Facebook, YouTube, Twitter, Instagram, and LinkedIn. Remember, All County Healthcare always puts the patient's needs first. You are listening to You and Your Doctor, Living Longer and Healthier, an informative show that helps you find answers to questions you always wanted to ask but did not have that somebody that could make a difference in your life. Call into the show if you have a question at 888-565-1470, and we will put you on the air to inform all our listeners. Now, back to our show.
Hello, South Florida and beyond, and welcome back to the You and Your Doctor Living a Longer and Healthier Life show. We have Dr. Raghu Sampath here. He's a cerebrovascular and skull-based neurosurgeon with Palm Beach Neuroscience Institute here in Palm Beach County, an Advanced Neuroscience Network Physicians Group in Miami-Dade County area of Hialeah, and on staff at St. Mary's Medical Center and Palmetto General Hospital. Dr. Sampath, you explained arteriovenous malformations. Now, there's another ailment called cavernous malformations. Is that kind of in the same ballpark?
Yes, yes overall, but very specifically looking, no. Basically, again, there's an abnormality in how the small blood vessels in the brain are draining blood, and they form what we sometimes refer to as a popcorn appearance on MRIs. And it's just another bunch of small blood vessels that have become like a small ball, a small tuft of an abnormal ball. And again, they vary in size. Some may not even get detected ever in life because they never become a problem. Some can be many of them. And in some cases, yes, they can, rare to see them bleed, but that's another way that you can usually find them. But also another way that patients have problems such as seizures, and then you get MRIs, etc., and you go on to find them. So yeah, it is an abnormality of blood vessels, a little different, I would say, for the lay person to put it as to what it is. in that it's different than a arteriovenous malformation, but it's in the realm of blood vessel malformation in the brain.
How do you detect and then treat these malformations?
Well, detection is always with some form of imaging, which is MRI. That's the best way to find them. But you would do it for a reason. Typically, patients may have seizures. Sometimes we find them again just by stumbling on them, as in the scan for the brain was done for some other unconnected reason, and you go on to find a small cavernous malformation. There's other terms for it, cavernoma or cavernous hemangioma or angioma, different words for the same thing. But yeah, or in those rare and unfortunate circumstances where they've bled and caused some problem, that's what brings the patient to into attention, and that's what you get an MRI for, and then you find them. Well, how do you treat them? Well, again, depends on how big they are, where they are, what they're doing, and of course then overall, what is the patient like, how old are they, how healthy are they. There's ways to do surgery and remove them. Of course, getting into more detail about that will be very exhaustive and extensive. There was a time where we used to think these can be treated with radiation, very localized radiation, but we have now come to understand it may or may not work, so that's still an area of study. But for those that need surgery, again, there are very specific reasons or indications why you would do surgery.
We're here with Dr. Sampath, cerebrovascular and skull-based neurosurgeon. I want to ask you this because I'm really interested in your response. What is cerebrovascular bypass surgery? I'm quite sure a lot of people would know what a cardiac bypass is. That's what I was thinking.
Yes.
That's why I was interested in your response.
Cardiac bypass, a patient have, heart attacks or chest pains, and, one of the arteries is blocked, and cardiac surgeons try to connect an artery from somewhere else to an artery of the heart to get blood to the heart. So doing the same thing for the brain is a cerebral bypass surgery. So again, going to too much detail will be a very lengthy discussion. But again, it's a condition where the brain is not getting enough blood, and you try to bypass the normal channel of blood flow to the brain by connecting some other arteries outside the brain to the arteries in the brain to get the brain to get extra blood. So that's basically bypass as you do for the heart, same thing for the brain.
So you may take an artery or vessel from somewhere else in the body?
There are options. You could take a vein from the leg. You can take an artery from the forearm. You could even connect the arteries in your scalp, in your skin, underneath the skin of your head, and connect it to the blood vessels inside. There's many which ways, and again, all those are very, very esoteric, I would say, very detailed to explain all that, which, can go on and on. But yeah, there's many options to do that. You can get an artery from somewhere else in the body, or use what you already have in your scalp.
I just found that fascinating, and we're getting so much great information here. We're so happy to have you. Another question I have, you were recently involved in a microsurgical clipping procedure down at Palmetto General Hospital in Hialeah as part of a treatment for a subarachnoid hemorrhage. The woman actually walked out of the hospital on her own 2 feet after recovery, and today she calls you her guardian angel. And the husband explained that you were you had a conservative and assuring approach, which he really wanted to, let us know about. Can you take us into that case? I know these are long cases and everything, hours and hours, but briefly kind of tell us a little bit about that.
Yeah, so subarachnoid hemorrhage is a very technical term in our field, as it just defines where the bleeding has been in the brain. There's different areas in the brain you can have bleeding. So subarachnoid is an area, a compartment kind of in the brain where you can have bleeding. And I think I know who you're mentioning here. So this lady had what we call an aneurysm, which is like a bubble on an artery, and it burst and caused bleeding. There's mainly two ways to treat these conditions. One is going through the groin or the artery in your wrist and treating it with a technique called endovascular, where you put in coils from the inside or stents to close it off. And the other way is to do surgery, which is what I do. And for current practice of vascular neurosurgery is you try to treat as much as you can, or the first attempt should be to treat it with endovascular methods. If for some reason that seems difficult or high risk or unable to do so, then we attempt to do surgery. And what we basically do is, yes, the skull bone is removed, we make a small window, go find the aneurysm where it is, and just put a clip around it. Basically, it's putting like a, if you can imagine a bubble, a balloon, and you're just tying it off so that the air or water doesn't escape or doesn't spill out. So it's similar, if I can put it that way, is to put a metal clip or titanium clip around the bubble so it doesn't burst or doesn't bleed again. It has already burst, so this is just preventing it from happening again.
I read one article where it kind of said if you could imagine a titanium paperclip kind of opened up.
Something
that.
like that,
I
yeah,
know
but
that's
more,
very-
yeah, more, there's more to it
It's
than
much more
Chad,
technical than
yeah,
that.
yeah.
So, again, we're here with Dr. Sampath. Now, there's also an awake. So that patient was obviously out. That was a lengthy, many-hour surgery. But there's also an awake aneurysm clipping, and I'm fascinated to also hear about this.
Yeah, awake brain surgery is not new. That's been in practice for many years. The concept of doing awake surgery for cerebral aneurysms, like the condition we just talked, that is a little novel, and not too many centers are doing, or there are some centers that don't believe in its utility. And there are experts in the country. They are definitely very experienced in this, and some believe it works, some people believe they don't. I was involved in a large study looking at the utility or the importance or the usefulness of this in my training, and we found that yes, there is some use to it. And yeah, the patient is awake just for very critical parts of the procedure, not for the entire duration, so that we can test them. And that's for me, that's the best way to know if the brain, if you don't cause any damage, if there's any ongoing problem. So as in, you can talk to the patient during surgery, you can ask them to perform some tasks, ask them to speak. So for me, I think it adds an element of safety. So I believe in it, but of course we have to be picky and choosy as to who is the right person to go through that.
Yeah, listeners and viewers will remember we've had Dr. Dalvey and Dr. Zucker on here, and when they do the deep brain stimulation programming, the patient is awake so they can test right then and there. So that's just amazing, that awake options. We have about a minute left, hard to believe. So what are your hobbies and passions in life outside of medicine? Everyone knows I always ask that question last, and we're always so interested in
I have a lot of interests. I play the piano. I was taking lessons. I need to do that again. I was a show jumper earlier in life, and now that I'm here, I know there's a equestrian center. I'm going to sign up there. I like traveling, I like skiing, I like sports. I've always been active. I used to paint and draw, and I think as I'm able to carve out more time in my career here, I'll try to pick that up again as well. I like photography. Again, I've indulged in many kind of interests throughout, and I just enjoy everything that I do. At the moment, yes, I would love to travel a lot, see as much of the world in this lifetime as I can.
That's great, and keeping the brain active, right? All
Absolutely.
those things.
Stay healthy. Yes, exercise, eat healthy, avoid, alcohol, drugs, smoking, all those vices.
Yeah, definitely. And yeah, in Palm Beach County, we have a great area of Wellington, a very equestrian area.
Yeah.
And down near Miami-Dade, you have Davie. So you were in like two of the best spots for some of your
looking
interests.
forward to that, yeah.
Well, thank you so much again. This has been a great interview. We'll have to have you on again because your areas of interest is very long. You can check them out at pbni.com or annphysicians.com, or just, you can, either of those sites, just type in Dr. Sampath, Sampath, and you get a ton of info. But thank you again.
Great. Thank you.
And we'll see you
Great
next
talk.
time
Thank
on
you.
the You and Your Doctor Living a Longer and Healthier Life show.
Thank you for letting us share with you a longer and healthier lifestyle. If you have a doctor or are a doctor and wish to be on the show, call AMP2 TV at 866-244-5422, and we will put you on the air as soon as possible. Tune in next week for more information on living longer and having a healthier life.